Joining me now is Dr. Phionah Atuhebwe. She's a vaccinologist and immunization expert. She's also the Vaccines Introduction Medical Officer for Africa at the World Health Organization. A perfect person, Dr. Atuhebwe, for us to be talking to. So tell us why Ghana? Why is Ghana the first country to receive coronavirus vaccines through COVAX?
Thank you very much. So why Ghana? There is not a straight answer to that, because there are many countries that actually were at the same stage as Ghana. And we are having another 16 African countries receiving their first batch of vaccines in the next few days. But Ghana was one of the very first countries for the COVAX facility and also for the African region to sign everything that was required. They signed all the agreements that were required with the COVAX facility, with the manufacturers. Their import permits were ready, and everything was just ready for them to receive the vaccine. But the good news is 16 other countries are at the same level, and we are seeing the next vaccines moving into countries in the next few days.
So you mentioned the next vaccines. Dr. Atuhebwe, this time it was Oxford AstraZeneca. Will there be an initiative involving other vaccines, Sputnik V from Russia, Sinopharm from China, and of course, what we're seeing in the United States, Moderna and Pfizer vaccines? Are those also going to be part of this initiative?
Yes, the COVAX facility has a number of vaccines that either are going through the emergency use listing, the pre-qualification and review of dossiers by the pre-qualification team at the World Health Organization. The COVAX facility will only give countries vaccines that have received approval for emergency use listing by WHO. So the Sinopharm from China, the Sinovac from China, the Moderna, these other vaccines we have, the Pfizer did receive emergency use listing approval by WHO in December, by the way. The AstraZeneca received it just last week, and we're very impressed to see that the vaccines are out as soon as immediately. But we have many other vaccines, actually, 12 of them that are undergoing review right now. And once the documentation and the safety and the efficacy and everything they've provided satisfies the World Health Organization pre-qualification team, then the approval will be given, and these vaccines will definitely be sent out to countries.
Talk about how vaccines and virus mitigation, if you will, has really worked across the continent. Clearly, there are countries in Africa have done a lot better than others.
That is very true. We have countries that have been hit much more than others, and we have countries that have really done a good job at mitigating the virus. But this has so many factors that are attached to it. The populations in the country, the lockdown measures that were put in the country, even when stringent lockdown measures were done, for example, for a country like South Africa, we are still seeing devastating effects of the virus. But also the differences in countries was the rate of testing. The rate of testing per capita in countries differed, and that's also influenced the results we're seeing. But a few serological studies that have been done, epidemiological studies, serological studies among populations show that we actually had higher numbers of people infected than far way higher than we did report.
Very quickly, Dr. Atuhebwe, how concerned are you about this strain that has surfaced in South Africa and also now in other parts of the world?
This is a very big concern for us, but a lot of lab work is going on to follow up the countries that are manifesting this strain. The good thing is that a few weeks ago, the Strategic Advisory Group of Experts to the World Health Organization did advise that we can still go ahead and use the AstraZeneca vaccine in a number of countries, and vaccines will still be able to prevent the severe disease and mortality, which is the acute part of the crisis of the pandemic that we are trying to prevent right now. We are really concerned about the variants, but with the vaccine coming out now, we hope that we can mitigate all the effects that could arise from these new variants.
All right, we'll leave it there. Dr. Phionah Atuhebwe, thank you very much.